Aly-Khan, we are moments after the prostate cancer oral presentations ended. Big presentation, long-awaited data looking at biomarker selection and targeted therapies in mCSPC. What do you think about the amplitude data we saw?
Yeah, no, I would agree. I think that's probably one of the more highly anticipated. Lots of great data, but I think the amplitude trial was probably one we really wanted to see as we keep moving things earlier. So just to level set for everyone, we're talking about mCSPC patients in the amplitude trial. These patients who needed to have an HRR altered gene, and in this case, a select panel, BRCA1, 2, BRIP1, CDK12, CHEK2, FANCA, PALB2, RAD51B, and 54L. These were patients who could not have had a prior PARP, obviously, or an ARPI other than abiraterone, and stratified by BRCA2 versus CDK12 versus all other alterations, prior chemo, and then your disease volume, randomized 1-to-1, the control arm getting abiraterone and prednisone with ADT and then a placebo, or the interventional arm being abiraterone with ADT and then niraparib. Now this is at 200 milligram daily dose. Primary endpoint of rPFS, which is a very common registration endpoint, and lots of the usual key secondary endpoints. Now, abiraterone was allowed to be up to 45 days, and that's going to be important as we talk about implications and what we're going to do with this data.